This video is brought to you by Haven House Recovery Center. Everything you need to know about oxycodone addiction. OxyContin is a controlled-release opiate brand of oxycodone. It affects how the brain and the central nervous system feel pain. OxyContin is considered a potent medication for people suffering from severe pain. Moreover, it also provides temporary relief to people with unbearable pain. Oxycodone addiction is not at all rare, either. In fact, it is among the most common types of addictions one can form. For people with moderate to severe pain, the dosage recommended for OxyContin to be taken is every 12 hours. This medication is also available in different dosages, starting from 10 up to 160 milligrams. Even though it is in the form of a pill, this medication's potential to be abused is very high because it can still be crushed, snorted, smoked, chewed, or even injected. Despite the efforts of health department initiatives and pharmaceutical regulations to limit this medication's availability and curb side effects and potential abuse, some people can still find a way to get their hands on it. Why is oxycodone addictive? Oxycodone is addictive because it can stimulate a rush of dopamine in the brain. As we all know, dopamine is considered a happy hormone. A person's body releases dopamine as one of the catecholamines responsible for pleasure. Dopamine is released during pleasurable situations like eating food, having sex, or using oxycodone medication. When released, a euphoric high is expected. A person's body perceives the euphoric high as a craving. This situation poses the potential for oxycodone addiction. Why do people abuse OxyContin? OxyContin contains oxycodone, so it produces the same euphoric high that we just explained. People become dependent on the medication and will start to crave it. OxyContin's addictive properties are also gradual, meaning they do not happen instantly. People tend to develop a tolerance before it turns into an addiction, meaning their body stops naturally producing chemicals that the medication will provide, and a regular dose may no longer manage their pain. For instance, in OxyContin tolerance, a person suffering moderate to severe pain might tolerate the dosage given to him, and his brain and nervous system get used to the increased amount of chemical. Lowering the dosage might not work, and the possibility of craving a higher dose is highly possible because he no longer perceives the effect of the medication as usual. In this situation, abusing OxyContin is often the most expedient way for him to satiate such a craving. Signs of drug abuse, OxyContin. There are several physical, psychological, and behavioral signs of OxyContin drug abuse. They include craving OxyContin, developing oxycodone tolerance and requiring a higher dose of oxycodone to manage pain, an interference of daily activities due to OxyContin use, an inability to stop using OxyContin, having withdrawal symptoms upon controlling OxyContin intake, using a higher dose of oxycodone too frequently, even with no intent of misuse, continuing to use OxyContin despite awareness of the risks. Effects of OxyContin abuse. If you notice someone has an addiction to OxyContin, you may notice the following behaviors or effects. Increased doses of OxyContin, mixing OxyContin with other substances, vomiting. Psychological changes, headaches, seizures, vertigo, diarrhea. Unusual perspiration, hallucination, respiratory depression, constipation. Itching, fatigue, confusion. These effects of OxyContin abuse may or may not be present all at once. However, a person addicted to OxyContin will likely experience all of these at some point if they do not stop. Treatment of OxyContin abuse. OxyContin abuse can be handled through inpatient and outpatient treatment. For inpatient treatment, there will be a specific program after detox that you must follow religiously. Group therapy is also a pivotal component in recovering from addiction. For outpatient treatment, this is usually recommended for patients who have successfully finished their inpatient program and are confident to face the outside world without the fear of relapses. Group support therapies and counseling are always available too. You can heal in any environment as long as there is enough guidance and support of the licensed staff in a Christ-based center like Haven House. Call us at Haven House now.